Never ever ignore these 9 warning signs of breast cancer, as almost 30% of women, or we say 1 in 3, are purely at risk of developing breast cancer. So let's not waste another moment and dive right into the first and perhaps most well-known warning sign. Number 1, the lump in the breast. Any new or unusual lump on the breast is always something to take action on. It could be a harmless cyst, a benign growth that's just passing through, but it could also be something more serious. So how do you know the difference? That's where the devil is, but you know what details are. A lump from cancer is often very hard, with uneven edges that do not feel smooth and firm within the surrounding breast tissue. It can be hard, solid, even immobile at times. It may be irregular, not nice and round like a cyst. Now, though many breast cancers are painless, others may cause discomfort, or in rare cases produce a sharp stabbing or poking sensation. Instead of panicking, if you feel a lump, even what seems like an insignificant or small one, just set up an appointment with your doctor, and they would be able to do a more detailed exam that might involve getting an X-ray or sonogram of the lump. Alright, let's move on to the next critical warning sign, one that often flies under the radar but can be just as significant as a lump in the breast itself. Number 2, lumps in the armpit or collarbone. Breast cancer is also a type of cancer that metastasizes. It often first spreads to lymph nodes. Your immune system has these tiny bead-shaped structures scattered across your body, including areas like your armpits and near the collarbone. Lymphatic system lumps form because breast cancer cells can get caught in the lymph nodes, which causes them to swell after spreading away from the original tumor. These are not mobile, but may feel hard and be tender. They could make their presence known to you when in the shower, putting on deodorant, or even just reaching for something. These bumps can sometimes appear before an obvious lump in the breast itself. Hence, never leave out your armpits and neck when doing a routine skin check, which means not every lump of these areas is the sign of breast cancer. It could be an infected lymph node or some other non-cancerous lump, but no matter how it comes about, a persistent lump, especially one that does not go away on its own, should be reported to your doctor without delay. Number 3, swelling in the whole breast. This type of swelling is often associated with a rare but aggressive form of breast cancer called inflammatory breast cancer, or IBC, that spreads rapidly through the breast tissue, causing inflammation and various changes. The breast might become noticeably larger, red, and warm to the touch. It might feel tender, heavy, or even itchy. The skin might take on a dimpled or pitted appearance, sometimes described as resembling an orange peel. Now, I know this sounds scary. IBC is a serious condition that requires immediate medical attention, but it's important to remember that not every instance of breast swelling is IBC, and while IBC is rare, it's still treatable, especially when detected early. Other conditions, like mastitis, a breast infection, or even hormonal fluctuations, can also cause swelling. That's why it's important to pay attention to any changes in your breasts and consult with a doctor if you have any concerns. Number 4, sudden changes in breast size or shape. It's a sudden, noticeable shift in size or shape, often in just one breast. It might feel heavier, look fuller, or even change its contour. You might notice a difference when you put on your bra, or even just by looking in the mirror. While these changes could be due to a benign cyst, a fibroadenoma, a non-cancerous tumor, or even hormonal fluctuations, breast cancer can also alter the structure of your breast tissue, leading to these unexpected transformations. So, instead of ignoring it, watch out for your breasts. See if there is a sudden increase in size in one breast compared to the other, a feeling of heaviness or fullness, a change in the shape or contour of your breast. Even a burning sensation or redness can sometimes accompany these changes. It's easy to brush these off, to blame it on hormones or age. But remember, your body is speaking to you. These changes are a signal, a plea for attention. Don't ignore them. Number 5, skin irritation. This irritation would not be the usual dry skin kind, but a nagging, localized itch, maybe with redness or a rough texture. It's like your skin is whispering a warning. Breast cancer can sometimes cause these changes, even signaling rare types like inflammatory breast cancer or Paget's disease. So, if you're experiencing persistent itchiness or irritation on your breast, don't just reach for the lotion. Pay attention. Is it localized to one area? Is it accompanied by any other changes, like redness or thickening of the skin? If the answer is yes, or if you're just unsure, consult your doctor. It might be a simple skin condition, but it could also be an early warning sign of something more serious. Number 6. Dimpling of the breast skin. If you look in the mirror and notice your breast skin looks different, not smooth but dimpled, puckered, almost like an orange peel, that's a red flag. This dimpling, also called peau d'orange, can happen when a tumor grows beneath the skin, pulling on the connective tissue and creating that uneven texture. It's like a subtle tug, a distortion in the fabric of your breast. It might be subtle, easy to miss at first, or it might be more obvious, especially if the tumor is larger or closer to the surface. It's often accompanied by other changes like redness, warmth, or even thickening of the skin. It's not always dramatic or easy to spot. Sometimes it's subtle, a slight unevenness you might notice when you raise your arms or lean forward. But it's a change, a disruption in the usual smoothness of your breast. So, pay attention to the details. Look for any puckering, dimpling, or even a subtle change in texture. If you notice anything unusual, don't hesitate to talk to your doctor. Number 7. Unexplained breast or nipple pain. Breast pain can be tricky. It's often dismissed as something hormonal, something related to your cycle, or even just stress, and most of the time it is. But sometimes it's not. Breast cancer can sometimes cause pain, especially in its later stages. It's not the most common symptom, but it's one that shouldn't be ignored. The pain might be caused by the tumor itself pressing on nerves or surrounding tissues, or it could be a sign that the cancer has spread to other areas. So if you're experiencing persistent breast or nipple pain, don't just try to tough it out. Talk to your doctor. They can help determine the cause and rule out any serious concerns. Remember, your body is sending you a message. Listen to it. Number 8. Visible veins on the breast. Breast cancer, particularly as tumors grow, can interfere with the normal blood circulation in your breast. This can make surface veins appear larger as your body tries to redirect blood flow around blockages. Of course, prominent veins aren't always a cause for concern. They can be more noticeable due to a variety of factors: age, weight loss, pregnancy, even just the way you're built. But if you notice a new vein becoming prominent, especially if it's only on one breast or accompanied by other changes, it's worth paying attention to. Don't panic, but don't ignore it either. Schedule a visit with your doctor. They can assess the situation, determine the cause, and put your mind at ease. Alright, let's move on to the final warning sign on our list. It's one that can be particularly alarming, but like all the others, knowledge is key to taking swift action. Number 9. Nipple discharge. Now this one might raise some eyebrows. We're talking about any fluid, other than breast milk, coming from your nipple. It could be clear, milky, yellow, green, or even blood-tinged. It might happen spontaneously, or only when you squeeze your nipple. Nipple discharge can be caused by a variety of factors, many of them completely benign. Hormonal changes, certain medications, even just friction from clothing can trigger it. But sometimes, it can be a sign of something more serious, including breast cancer. Certain types of breast cancer, like ductal carcinoma in situ, DCIS, or invasive ductal carcinoma, IDC, can cause changes in the milk ducts, leading to nipple discharge. In these cases, the discharge is often bloody or clear, and may only come from one nipple. This is a sign that you really need to make an appointment with your doctor. They can examine the discharge, possibly order imaging tests, and determine the underlying cause. All in all, remember, we're not trying to scare you. Just knowledge is power when it comes to your health. So pay attention to these warning signs and take action if necessary. Remember, early detection can greatly increase the chances of successful treatment for breast cancer. Don't ignore any changes in your breasts, and make sure to regularly perform self-exams and get annual mammograms starting at age 40. Stay educated and aware, ladies.